Hello, good afternoon. This is Oriol Gallemi. I'm a researcher at the Institut Químic de Sarrià from Barcelona, and I would like to introduce my findings over this boring time of research at home. So with my colleagues, we were starting to forecast this, and first what we did is to establish the fatality profile based on the different papers available from the net, and what we saw is what is evident to everyone. So above 60 years old, above this age, people have heavy chances of having a fatality once they present heavy symptoms. If they don't, if they are in the 80% of population that they don't show any symptomatic course, so or very mild and symptomatic, so he will be lucky and will not suffer from any of this. And of course, even if you are showing or displaying a clear symptomatic course, even and you are below 60, so you are the lucky guy within the 0.2% that will not suffer anything. So that's roughly what's the status quo by the time. The other thing is that which is available in the net are the population pyramids, and you can go and crunch data with any country, so you download it and then you can make your guesses, because you have about 80% roughly that they will not suffer from heavy symptomatic, and then the others that will display evident symptoms of getting infected. And by crossing both and plus the slide before, then you start getting how many people will be infected and how many fatalities will have the country. Secondly, that's the infection curve. The infection curve is shown and as the total number of people which will be infected and that will suffer from it. But the area, the surface under the curve, it will almost remain constant because the virus has a spread which is 3.5 it's believed to be, and that is not going to change heavily. So it will change momentarily while you are stay at home, but once you are released and all these lockout countermeasures are released, so the spread of the virus will be as it naturally is, and it's a heavy virus as never seen before. But well, there are heavier viruses before, but they were not spreading in that way. And then this surface cannot be changed easily. Finally, what we have is that whatever the measures that we are taking, this is gonna strike back at any given time. But the only thing that we are going to change is just to shift the time that this curve is going to happen. So either we start here and we saturate the whole system because the capacity is this red line. Either we saturate this the healthcare system from this time to this very end, which is above 1 year, or roughly speaking 1 year, or we just saturate it for a few months and then we keep going on and we try to get back to our lives without all these missing people. So this is what it is by this simulation, or at least a schematic drawn by the Imperial College of London, and many simulations display about similar results. So what is going to happen? So we will stress the fatalities in any country. This is the number of dead people per year in the different countries, and this is the population susceptible of having a crunch with the virus. So, however, by the end of the year, the figures regarding the standard prediction, the standard forecast, are likely to get down because traffic crashes and many other incidents and many other accidents that happen during the course of life are not going to happen because we are confined and we are because of this restriction. So we will have 2 months of or at least or 3 or 4 months of our lives that will be way safer. However, in the other side, we will have a steep increase because of the coronavirus, and maybe it are not going to happen in the very short term, but it will affect unless there is a vaccine which prevents from happening, which it would be a really not shifting the curve. It will be completely deleting and removing the tail of the curve. So the other thing that we did was reconstructing the curves to check how many fatalities we had and how was that related to the infections declared. And well, it seems feasible for the US that the number of fatalities, so here we have several indicators. The first is the number of infections, the killed or the fatalities occurred in the US, and the recovered. So what we can see is that from the baseline curve, so we can go back and we can trace how is the infection curve, and yeah, it seems pretty feasible and pretty credible. The other side, we have, for instance, countries like China. China, they declared this infection curve, which was about to flatten here, but now at the end it flattened over there. But if we place both and we reconstruct it, comparing the timeline of the events, it seems that they are on the right way, and the numbers are about to get roughly about 80,000 infected, and the fatality number will be pretty low. You have to note that this figure is the cumulative infections, accumulated infections. So all this figure does not represent the, for instance, if you are watching the synthetic curve by taking the killed ones, so this is not, they are not about to be 80,000 killed people. It's if we trace back to how many infected people were a few days ago, and the percentage of people which are saved are this. Okay. Then, if we go back to Europe and we check the other countries as Germany, France, or Italy, we see that the curves are consistent on each other, and there is no question. So all the data is consistent, so we can easily extrapolate the data, and we can handle this. From Spain, it looks that that is somewhat feasible as well, yeah, according to the simulation. How South Korea, of what we see is that there are misleading indicators from two sides. First of all, the granularity of the data does not allow for a proper modeling, and then there is a strong gap between the reconstructed curves, especially the death ones, the fatality ones, and the infections. So theoretically, by tracing the fatality rate, the infections should be about not doubling but roughly doubling. So maybe we have to observe this country and the procedures. Maybe there are many infected which are not taken into account, probably. Japan, of course, the curves display that are completely consistent one each other, so there are no comments regarding that one. The rest of the world is also following the exponential side of the curve, and up to now, everything seems consistent with it. But taking from by placing this aside, what we have seen is that the parameters from the different models are not matching. So while in Spain the fatality rate declared is above 21% roughly, in South Korea the fatality rate from the records is roughly 1%, and let's say 3 to 5% in Japan, China, and the rest of the world is 6%, and Germany and the rest of Europe is about 9%. So it may point that the number of days staying in the hospital has a somewhat correlation with the fatality rate. It doesn't mean that staying longer it will heal you, but I think that after strong discussions with our team, this means that the natural behavior of the virus, the natural lethality of the virus should be around here. while the system is not saturated. Here you have a clearly non-saturated system, but has a strong discrepancy with all the rest. But it will be roughly around this point. And what happens here is that we are overstressing our healthcare system, so we are unable to attend many infected people, and the only ones that are attended are the ones about to die. And that's why we have such a fatality rate in Spain and all the other European countries, which early on minimized the effects or the potential effects of the virus. So here are the figures. South Korea has a recovery times of about 25 days, while Spain, the time to discharge from the hospital is about 11 days. The fatality rate is about 21% in Spain and 1% only in South Korea. This is more than an order of magnitude. So by having roughly the same time to fatality, which is roughly 1 week, because people when they go to the hospital, they are really sick, they are feeling really bad. This is probably one indicator that if the virus is killing about 4% of the people who are declared infected, maybe this country has about 5 times at least the amount of infected people they declare, but they have not even been tested. And also you have plenty of people which are being tested in the other countries or are not being tested in the other countries and display symptoms. So that would add maybe 3 times more to this amount of really infected people, but they don't display any symptoms. So by extrapolating this, we have developed an estimated clinical course, which will be roughly like this. So people are getting exposed on day 0, and then they suffer from incubation period, which stands from 2 days, maybe 4 roughly. But the exposition may be repeated over the time because they stay at home and they touch different things and they talk each other and they are passing by. So you may have a bouncing exposition all over the time, and people can get really exposed for longer days, also at work, with pets, and so on. Then if people start getting sick, they get infected on day 2. But from day 2, there are more things. It is asymptomatic, and the virus shedding starts. So people start having a lot of concentration of viruses on the mucosity and the mouth and the saliva. So when they speak and they don't feel bad, but they are 2 days completely inadvertently going around and infecting others. So from the day 5, people start feeling fever, dry cough, dyspnea. So it's respiratory difficulties, and then they have the syndromes which are heavier. And people used to attend the hospital from day 5 onwards. And once they are admitted, within 7 days, they are either on the way to die, either on the way to heal. And on the way to heal, they used to stay there in Spain roughly from day 5 to day 16. So, and in many other countries up to 18, 20 days after. And here, some countries start discharging people with light fever or not, or very, very mild. So far, what is also known is that this virus is really an RNA-based virus, and is fast changing and has a strong adaptation on the surrounding environment. So we have to be very careful because we have pets. So, and finally, as a conclusion, so what I want to stress is that the surface under the curve remains constant regardless of we temporarily modify the R0 value. The infection curve can be modified slightly on the slope, but the amount or the surface of people under the curve will remain the same unless we don't change the dynamics of the virus, and this can only be done by medication, preventive or vaccination. But we need to disrupt the curve if it's flat enough. If the curve is damn steep, the curve is not going to change in the short term. And finally, to remark the risk of rebounds once the lockdown and all these countermeasures that we are taking temporarily are removed, because it will behave as it was before. Finally, the research lines that are not yet published, and I would like to see, are the mammals infection channel, because people have pets, and many pets have been tested and demonstrated that they can be host of the COVID, the disease, not only the virus but also from the disease, and they will suffer from it. So cats, dogs, and so on. And then we have a lot of studies that will be known in the longer term, that is the biosurvival ratio in asymptomatic hosts. So roughly what I said before, the hosts that they feel good, but and they do not develop the COVID as a disease, but they are transmitting the SARS all over the world, and they are spreading. Some papers say that the disease and those super carriers exist, and some deny this because this is justified by repeated contact. So, and finally, we have to find which is an effective and convenient and fast disinfection method in order to eradicate this new disease. Otherwise, it's not going to end, and it's likely that we are going to have a seasonal coronavirus because it's a global crisis already. So thank you very much for listening. Any questions, feel free to mail or comment below. Thank you very much.